My name is Heather,
I'm Erin.
and today we're going to explain to you how to set up a sub-Q fluid administration set.
When you go home with fluids, you get a bag of fluids that look like this. This is 1,000 milliliters or 1 liter. And each one of the little tick marks that you see on here represent 100 mils. And you'll have your instructions are usually on your bag for you as far as what you would administer. Most of the time we go home and we're administering at least 100 mils at a time, so you would know to go to the tick mark with the numbers. When you have to set up a new bag, you'll have a setup that looks like similar to this. There's perforated marks on it, so you want to tear that off, and you'll pull your line out. On your fluid bag, you have this nifty little pull handle. Pull that straight out. On your line, you have a little plastic cover here. This also just pulls straight up. One very important thing to always think about when you're doing this is that you don't want to touch the little ports on the fluids, or you don't want to touch this tip once you've removed the plastic pieces. Once you've done that, you want to stick this end straight in. Once you've stuck this into your bag, you're going to turn it over and give the little thing a squeeze. This kind of fills your line up. And now we're filling, it's called prepping the line, and you can see we have fluid coming out the other end. You want to do that until you have a pretty good steady stream. And one other important thing to remember on all these lines, you're going to have two separate clamps. We have this blue clamp. This is called a pinch clamp. If you squeeze it the other way, you can see we're squeezed close on the line so that the line is closed. This white clamp is called a roll clamp. When we're in the down position, we're closed off so fluid can't flow through. Once you roll it up, you can see that fluid comes through the line in a flowing, easy pace. So I'm going to go ahead and roll it back down, and now our fluids are off. These are just two things to remember about when troubleshooting any issues you're having with sub-Q fluid administration to your patients. You don't have to use both of the clamps. You can if you would like to, if that gives you better ease of your control for when you're administering fluids to your pet at home. Just choose to use one or the other, whatever one you are more comfortable with doing. And then lastly, in order to stick the needle onto the line, you have your 18 gauge needle. Has a plastic piece at the end. You're going to carefully twist it off until you hear a click sound. And now our needle is pretty exposed. On the end of your fluid line, you also have a little plastic piece. Again, very important to make sure that you're not touching the end of your needle or the end of your fluid line. And then you will carefully stick your fluid line into the tip of the needle and give your little line a twist up. Now this has locked your needle in place to the fluid line. This is Basil, and today we're going to be going over how to administer sub-Q fluids to a cat. So on kitties, we want to make sure that we're going from kind of their collar area to the back of their shoulder blades. This is where they have the most area for their skin and kind of the scruff area. When grabbing them for the fluids, you want to grab a good chunk. And you can see with my finger here, this is kind of making what I call a teepee tent. When you're ready to give the fluids, you'll want to take your cap off. You want to make sure that when you're looking at the needle, you have the opening part, it's called the bevel, facing up. This is for ease of comfort when you're giving the fluids to your pet at home. I'm going to go ahead and grab my area, make my teepee, and I'm going to take my needle and I'm going to give a good quick poke. You want to make sure that you're poking straight in and not upwards, because you might poke yourself, or down, because then you could accidentally hit the muscle of your pet. Now I'm going to go ahead and turn my fluids on. And if you can see here, the fluids are flowing nicely, and Basil is receiving his fluid treatment. When you're done giving fluids, go ahead and we're going to roll down our clamp here. And I like to use a tissue at home. I'm just going to simply cover the area where the needle is, and I'm just going to pull it straight out. And I'm just going to hold pressure where the needle was, and I'm going to carefully put my cap back on my needle. We'll just hold pressure here for like a minute or so. If you do see that there's some leaking coming out, that's okay. We did use a large bore needle. We did kind of make a big hole. It's simply okay that fluid leaks out.
Now that you're due for another treatment of fluid therapy and you still have your old needle on, it's important to change out your needle every single time. When you do that, you'll just be twisting it off of the end of your administration line, and it should come off very simply for you. To put a new needle on, it is still important that we don't touch this area, so we want to keep it as clean as possible. And then with your new needle, you're going to twist off the cap again until you hear the click. And again, you're going to put it right on your administration line. For storage of your sub-Q fluids, they do not need to be refrigerated, they do not need to be warm, they just need to be room temperature. It's not light sensitive, and if you need to keep them on your counter or in a cupboard, any of those areas are just fine. If your patient's treatment is over and you no longer are needing any more sub-Q fluids, or if the bag is empty, it's time to dispose of it. If your bag is empty, you can simply dispose of the bag and the administration line in the garbage after you remove the needle. If there is still fluid in your bag and your patient or your pet no longer is needing sub-Q fluid therapy, you can use a scissors just to snip a little corner of the bag and empty the rest of it down the sink safely. It is important to remove the needle, and this should go in a sharps container, whether at your veterinarian's office or another means, but it should not go in your garbage.